question then. Ask the question. The one that is called PSA, what does it stand for?
Prostate.
You are going to put up your hand.
Prostate specific antigen.
Very good.
Right.
Why would we do prostate screening in the way we? Alright. So, where the prostate is situated in the body, right? It's directly under your bladder, right? So your bladder is here, not here. Alright, let me talk. Let me talk to this data. Alright. So where your prostate is situated, right? It's directly under your bladder. So it's your bladder here that your urine is in. Through your bladder runs a tube called your urethra. And it runs from that tube, no, I don't need any mic. It runs from that tube straight down through the prostate and then down through the penis. All right? And that is how you're able to pee. Right? All right. Now, the purpose of your prostate is actually to nourish your sperm. Okay? That is the purpose of it. All right? So it makes the fluid that nourishes your sperm. Right? So it's important for reproduction. Right? But what happens to black male, right, and Jamaican male is that once you get to a certain age, we find that prostate cancer is very prominent. Like we have one of the highest rates of prostate cancer deaths in the entire world.
What?
Not just Caribbean, but in the world. Correct? So since we don't know, one time they used to say allot it to Aki because Aki was very oily, right? But they did test and Aki was not the culprit, right?
Okay.
So we can only think that why it is the reason is because we were men, not me. Men, Jamaican men were very sensitive to one of the most important tests that is used to determine if the prostate is healthy, right? Which is the one that you insert the finger. So most men were not being screened because of that, right? So we are now finding that when men turn up that we're screening, they are turning up with what we call advanced prostate cancer, meaning it come outside of the prostate and now it's gone in your bones, in your other organs, and we can't do anything about it at that time.
Okay.
All right. So why we have to do that test? Why can't go through your mouth?
Doing some
right?
educational
Or they can't open your mouth
about
and just take the
prostate.
prostate. This is why. So the prostate is now down here, so under the bladder, right? Now to the back of the prostate lies your rectum, right? So a doctor can feel whether or not the prostate is healthy, yes or no, by inserting that finger right on the tip here, so because of the fact that it backs up and presses on that area in the rectum. Understand? Yeah. That's not pushing anything, and I have no interest in pushing anything further than to feel the prostate. So don't think it even make me very happy and pleased and excited. All right? All we want to do is to run our finger along that area, right, with a gloved hand and lubricant to feel if it is smooth like the back of my hand. Now, if we insert and it is bumpy like my knuckle or has a lump, it means that your prostate examination would have been abnormal, right?
Okay.
But we don't leave it at that, because you can have an abnormal prostate and it don't necessarily mean prostate cancer. So we send you to do the blood test, which is a PSA. It's a prostate specific antigen test that determines the amount of prostate antigen in your blood, right? That test with the digital rectal exam gives the urologist better information to be able to decide what should I do now, what should I tell the patient to do now. You understand? A PSA
More
also
insight.
can be skewed by a lot of things. You recently had intercourse. You got the gift. You got it. Send me one message when you reach back a mandible. All right. So the PSA can be skewed by a whole heap of different factors. You could have recently had intercourse. You could have a urinary tract infection where a lot of them like the hole on the urine because they don't want to have the bathroom to pee and stuff like that. And when the pee will burn sometimes, that is normally a UTI. That can skew it. Other conditions can make your PSA levels elevated and you don't have any, it doesn't mean prostate cancer. So the doctor uses those two things to say, all right, when she bring all on the papers them together, she go separate them in a batches depending on what the PSA is and what the rectal exam shows. And then she will say, all right, this one good until next year. 1 year, you come back. Okay. One other set, she might say, yeah, I want you fit the rectal exam was not so, it was a little bit off. So I'm going to let, but your PSA was normal. So I'm going to tell you to go and do a PSA again in another 6 months, just the PSA. Or both can be abnormal. And she say, you know what? On the paper she's going to write, you need to go to urology consult. Get a urologist and consult with the urologist because both were not abnormal. Both were abnormal. All right? So we have 2 tests that we do. Right? What are the 2 tests that we do for prostate?
Yes.
PSA and
rectal.
And it's called a DRE. Digital, because your fingers are called your digits. Digital rectal exam. All right? Now, what is normal PSA reading? It is normally a 0 to 4, right? But depending on your age, Dr. Brown, as a urologist, will tell you that she prefers that if you're in your 50s, that your PSA should not be more than a 3. So if the 3 she's going to, with a normal digital rectal exam, she'll probably just say, okay, come retest in another 6 months and let me see what the PSA is. You understand? But knowing your numbers means that if today you do your test and when we call you for the results, it says a normal between 0 to 3 or 0 to 4, you will get something written saying everything is good. Come back in another year. So that in another year we can know if things are the same or things have changed. And there are treatments that can be had at that time once it is early detected. Okay? Any questions?
Make a lot of sense.
Even if you're the last man, because I see your instinct. Yeah. Right? So even if you're the last person, Dr. Brown is the type of person should not be in here. Alright? So I just wanted to give you a synopsis of why you are sitting here and waiting for this to be done. It's important. A blood test is not as conclusive as you doing both. Okay?
Thanks for your precious information.
Alright.
Thank you, Doc. Thank you, Doc.
Hello. I think it's sperm.
Alright, put on your hand there.
Hello.
Sperms on.
Put on your hand there. Your hand.
Production of sperm.
Alright, produce the sperm, wrong. Fertilizing. No, give me one other. No.
Max, what the purpose of the prostate?
Give me to the one other term.
Nourishing.
Nourishing. Alright.
So the purpose of the prostate is to nourish the sperms.
You know win.
Your first time here?
You know win. Didn't answer the question.
Alright, Garvey.
You get help. You get help. You get help here. I can just this is share here
One more prize.
I'm going to go on there for one prize.
Rectal examination.
Alright, question. The one that is called PSA, what does it stand for?
Prostate.
You are going to put up your hand.
Prostate specific antigen.
Very good.
Right.
Thank you. Thank you for being here.
Turn on, take a picture one.
But a few camera, we go get them the picture.
You can send him to you.
Post them to St. Mary Ann Cancer. All right. All right. ERE stands for.
Wait, the man them bright, man.
Bright Light Morning
My
Star.
gosh.
We say look down the side.
Let me hear what they call it. And when you reach the road,
All right. I stated something that can make your PSA elevated. Right? Why I said the reason why you don't only use the PSA test is because certain things can screw the test. What are three of those things? Put up their hand first. Put down on
So a man run us up.
Put down on the hand. What are the three things? What are the three things? Put up on the hand. What are it? Whoever put up their hand first.
The man.
What is a noble? Not true.
If you have sex,
If you have sex but you sell love. I mean, never did sell love.
have sex
Recently.
recently, urine, you have an infection in your
Very
urine,
good.
and
I said one more
Dark low.
thing.
it can have a burning sensation.
No, that it has to do with. I was just explaining what a urinary tract is. I actually said three things. What is the other thing?
burning.
Emotion.
Don't be
No, no. But I was that is already known that if you have cancer, it can give you an increased prostate. I'm going to give it to you anyways, but I was actually looking for the fact that other conditions can skew your PSA test. Okay. All right. All right.
Thank you.
Yeah.
All right. We have one more.
Give it to me without question.
What is the name of the doctor who started this all?
What is that? Don't hear the question.
What
Don't hear the
you
question.
say? Miss Brown, come. Dr. Marie Brown. Say it. All right. Come through.
Man them bright, man. Don't black out. Yeah. Why people them bright. We not follow the price.
Long time lion.
All right. So, remember, me not tell us that the urethra run through the blood and come down to the penis and you can pee? So, why we can't go through the mouth to do the exam? Not true.
Right now they know
we can't
where.
look down in our mouth and just know how a prostate looks.
Cannot.
Go on, me.
Because the prostate they below your. Yes,
So why
below.
the rectum? Why couldn't go through your penis?
Because it have something to do with your sperms.
Block. It blocked by a
You did it on your bed, they put it on your bed last night. And it was there this morning. Tell mommy say I put it on your bed too. That's what mommy.
It blocked your blood, may I tell you, man?
No, not necessarily. Not necessarily. Not everybody. All right, so they actually connect. That's why, but one is not. It's to the back. So see the bladder here, see the prostate here.
Yeah.
So the back of the prostate is your rectum, the first part of the rectum, right? So doctor not pushing up their finger, as you know, we don't know, not all the way and whatever foolishness one to take.
Awesome.
You understand? All they do is insert it with a gloved hand, just to feel if it feel like the back of my hand, because that is how it should feel. Now, if they feel it and it feel like my knuckle. This means that they're polyps. You see, it's going over like something. It's not supposed to be. It's supposed to be smooth like my back of my hand, right? That is why it's important to do a digital rectal exam. There's no other way to feel the prostate.
So we can get the hat now, car.
Right? And him gonna get the hat.
Oh, if you get the hat, and me, I tell you.
So the blood test.
And me, get
I asked him where it was located.
So the blood test can let you know if you have prostate.
Not by itself. It is the most conclusive thing to use.
You know what? I'll give you the hat.
Now, what is the PSA? Normal PSA. Anybody can tell me what normal PSA level is? That prostate specific antigen blood test.
From 0 to 3. 4.
I'm going to give you to 0 to 3.
Yeah.
0 to 3 depending on the age of the male.
Yeah.
But it's really 0 to 4.
Okay.
But say for instance, somebody who is 20 or 30 appear with 4. You know there's something wrong.
Something
because
serious.
A 20 to 30 year old not supposed to have. I remember say 0 to 4, you know.
Yes.
How you reach up there so and him only 20 and 30.
Something serious are going.
So you don't need to definitely check.
Yeah.
Because we wouldn't be spending
Too much sex can cause prostate. Sex good for prostate.
50s, 60s, that kind of age. We might at 4, we might be okay with that. Why? Because of your age. As you age, your prostate is going to enlarge, and because of that, it can cause the PSA level to be higher, even though there's not the prostate might.
So thank you. Yeah, ask our next question.
Don't forget the hat.
0 to 4, he said 4 first.
No, he said 0 to 3 first.
Who? Him?
Compliments of MDS, people.
Thank you, my dear.
All right. More question there. All right.
Oh yes, yes.
So,
I'm not even.
next question is 2 tests what they use to determine, right, for the screening for prostate cancer. What are the 2 tests? Put up on the hand and tap.
Put your finger in a rectum.
And PSA.
Put the finger in a
What name, so? We don't know test names, so.
DTA
No.
no one.
Anybody else? PSA is the same as the lab.
No, the PSA and the DA is something.
The PSA and the DRE.
DRE.
The DRE is the one you went in there. Digital, your fingers are called your digits. So digital rectal examination.
Examination.
Alright? No, you never said that.
Still can't compare, man.
So moving this up now.
And the
Alright.
closest enough.
What is PSA? What it stand for? PSA. The blood test when you're going in there waiting to do. What is it? What does it mean? PSA.
Prostate screening.
But the on-site ask you what about?
Prostate specific antigen.
Antigen.
Prostate specific antigen. All right.
We are saying of the blood test line.